DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show today. Our guest is Dr. Mike Sanderson from the College of Veterinary Medicine at Kansas State University. We're going to talk about biosecurity and the cow herd. Stay tuned.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and we're here at Kansas State University where we have a guest, Dr. Mike Sanderson, who is the Jones Professor of Epidemiology at the College of Veterinary Medicine, and you are in the Department of Diagnostic Medicine and Pathobiology. Is that correct?
It is.
All right, great. And Dr. Sanderson has been a colleague and a friend for 2 decades, and he is known throughout the country when it comes to beef epidemiology and beef cattle medicine. Just a tremendous resource on many different topics, but we're going to talk about biosecurity today.
Good, great topic. Thanks for having me, Dan.
Yeah, appreciate you, Mike. And so when we talk about, we're kind of leading off, you said maybe we'd talk about just finding out what kind of diseases you have in the herd.
Well, I think that is important. There's not a lot of point in spending money excluding diseases that you already have. So it's good to have a little bit of an idea of what you already have. For example, if BVD is already in the herd, you may want to get rid of it. But spending your money keeping it out when it's already there is of no value.
Right. What are some of the things or disease opportunities that you would be thinking about with that internal assessment?
In order to do that, you need to have some decent records about performance and things, and that will often give you some good clues about what might be going on. At other times, getting some good necropsy data from animals that die, when you have calves that die or anything that's sort of an unexplained death at least, it's good to get your veterinarian out, have a good necropsy done, get some diagnoses so you know what's already in the herd. Certainly, there's some things you can work to get rid of and keep out, other things that they're just everywhere, and you're probably not going to be able to either get rid of them or keep them out.
Right. And there are things that I would assume that's based on how it's transmitted.
It is, and to some extent just how common it is. So IBR, for example, is just everywhere. There's no point in trying to keep IBR out of a herd. But we can't manage it. BVD, on the other hand, is a bad disease, but it's not everywhere, and you can establish a free herd with some careful work.
So we can do things with viruses, some bacteria, or maybe, and then parasites, and all these different levels of understanding of how they impact performance, how they impact reproduction. I guess that's how you start to see it.
I think that's how you start, and then just having a good relationship with your veterinarian so that they can help you understand the differences between those different agents and how they may be introduced, how they may act, and what you can do to control them if you can't get rid of them, or get rid of them if that's possible.
Yeah. So I assume that if you're going to do something with endemic disease or kind of look at what's going on within your herd, there'd be a certain sampling protocol too, if after you identify something, because you wouldn't necessarily have to test them all to start out with, would you?
Right. Yeah, and that's something else that your veterinarian can help you with as far as who you should sample within the herd. There may be particular groups that are more important than others, and then how many do you need to sample in order to get a good estimate of what's really going on.
So if you start to see something like a decreased conception rate, or you have decreased growth rates, or animals not reaching physiological maturity when you think they should, start to look at some of these diseases, work with your veterinarian, because they're going to call somebody like Dr. Sanderson and help.
Yeah.
He's going to help us design a plan.
Yeah, hopefully.
Great. All right, we're going to take a break. When we come back, we're going to talk about how you kind of contain those types of diseases within your herd with Dr. Mike Sanderson.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today on Cattle Intel, we're going to focus on breeding soundness exams in our bulls. Cow-calf operations rely heavily on the success of bulls to breed cows. So using bulls without a breeding soundness exam is like driving a pickup without a fuel gauge. Eventually, you're going to be walking. So a good BSE, or breeding soundness exam, starts with your veterinarian checking your bull's physical condition, making sure the bulls have good feet, good conformation, normal legs and back, and overall body condition are all crucial for breeding activity. Another key element is testicular evaluation, looking at the size, symmetry, and development or even atrophy of the testicles. The penis is checked for injuries or abnormalities that could prevent breeding, but the exam obviously doesn't stop there. Semen is usually collected and analyzed for sperm motility, concentration, and shape. Remember, a BSE is just a snapshot in time, but it is the best place we can start. Remember to always schedule your BSEs at least 60 to 80 days before the breeding season. This allows for enough time for reevaluation if the semen quality falls short or the bull doesn't seem to up for what he needs to accomplish. Early detection is always going to save you money, ensures a productive breeding season. Don't leave your herd success to chance. Make sure to get good breeding soundness exams for your bulls.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
I'm Jeremy McBride. I manage the ranch for Wilmoths here in Southwest Missouri. Probably the biggest challenges in Southwest Missouri is the weather. That's where the therapies has helped us. The last day we got through weaning, it was 65 degrees and sunshine, and the very next day it dropped to 35 degrees, rained 2.5 inches, which is very, very hard on these cattle. And we doctored 2 head.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Sanderson. And Dr. Sanderson is a professor in the College of Veterinary Medicine. He is the Jones Professor of Epidemiology. He is in the Department of Diagnostic Medicine and Pathobiology, and we're here in Manhattan talking about cows and diseases and biosecurity.
Great topic.
Absolutely. It's something that we enjoy anyway. Talk to me a little bit about, because one of the things that is intriguing to me is how do we maintain, we have herds or groups within herds. And so how do we help contain disease within herds to not spread it to everybody?
There's a number of things you can try and do. And we talk about something called risk group segregation. So that sounds hard, but it isn't necessarily. We'd like to manage different groups so that if we get disease in one, it doesn't transmit to another. Young calves is a great example in that we'd actually like to manage those as different age groups. So the calves that are born early in the year, we really don't want to have contact with the calves that are born later in the year until, we're out on grass a while. Because those older calves can be the source of infection for the young calves that are much more susceptible to it. So that would be an example of sort of segregating those groups to try and control diarrhea, in this case, transmission within the calf herd.
So if we had something where we're calving year round, and we're weaning twice a year, you're going to have cattle from all different types from age groups and weights is just a recipe for disaster.
Yeah, the calves that are young calves in that group at any particular time, less than 6 weeks of age or something, are going to be high risk for whatever else everybody else is spreading around. So you've just sort of always got that group, and unless you can segregate everything into groups of one, it's pretty hard.
Yes. Any other types of ideas, vaccinations? I'm assuming that if there's a vaccine available, having the appropriate vaccine protocol is important.
Yeah, so vaccines are really important. They rarely provide sterile immunity, probably never. Right. So we can't vaccinate animals and expect that they will never get disease, but if they're good vaccines, they'll decrease clinical signs. They may not have clinical signs at all, and they'll likely decrease the amount of shedding that an animal does so they doesn't expose other animals as much. So as part of an overall plan, vaccines are really valuable and important.
Yep. And I assume that when we start to talk about these diseases based on your geography and what different things are endemic in different parts of the US, that working with that veterinarian to understand.
Absolutely. They'll know their practice area around there, and they will also have some inroads to the local diagnostic lab, so they'll have a lot better idea of what are the things we really should be concerned about.
So when we start to think about that, then understanding that what virus or what bacteria you're trying to keep out is important, right? Because you got to know how it's transmitted.
Yep.
So if it's a vector, we're going to focus on controlling the vectors.
Yeah. Right. So you have to control that vector, and you can do that with segregation, but it's got to be segregated far enough that it's farther than that vector will fly.
Right.
So that can be challenging.
Yeah. So anyway, any more understanding or ideas on within herd?
Yeah. So, and a couple other things that could just be very helpful is being careful about equipment. So we wouldn't want to clean the pens and then use that loader to feed calves. Those sort of things where we can take manure from the adult cow herd and transfer it to the calves can be a really bad thing.
Cool. Well, some great information. When we come back, we're going to talk about keeping some bad things out of your herd with Dr. Mike Sanderson.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimetaBiologicals.com to learn more.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Mike Sanderson, and we're in Manhattan, Kansas, where Dr. Sanderson is the Jones Professor of Epidemiology at the College of Veterinary Medicine at Kansas State University, and we've known each other for over a couple of decades and got to work together, and Dr. Sanderson is one of those that when you have an issue, you know he's going to be there, he's going to help, and he's so responsive, and very thankful for all you've done for veterinary medicine and for the beef industry.
And for you too, Dan.
Yeah, I appreciate it. You know, we've talked about keeping, controlling, finding the disease in our herd, and then while we're getting rid of it, make sure we don't spread it from big cattle to little cattle and all that. But the other side of this is maintaining a herd. If you go to all this work to clean it up, now I want to keep things out.
Yeah.
How do I do that?
Well, that can be challenging. And again, this is a place where having your local veterinarian really get involved and help you with that can be great. Again, as we've talked before, it depends on which pathogen, which virus, bacteria, or otherwise we're talking about. They each act a little bit differently in how they're transmitted and whether or not they may have a carrier state in the animal. And so that changes how you may implement a plan to keep them out. So we could talk about a couple examples. If we take BVD, for example, common problem and can cause some really severe issues. Testing animals can be an effective way to try to control introduction, but you got to be right about who you test and when. So for example, our biggest concern with that is persistently infected animals. And they come in often. You could purchase them as calves, could be a heifer that you purchased, but it could be a heifer that's not persistently infected. She's fine, but the calf within her is persistently infected. So if you tested that heifer, you'd say she's negative, but come calving time, you have a PI in the herd.
The Trojan horse.
So exactly. So you kind of have to get some guidance about who you test and when in order to effectively exclude BVD from a herd.
So then what about quarantine?
So again, that's a great example, and quarantine works really well for diseases that are going to manifest themselves in some manner, and the animal get over it during the period of quarantine, so that you can quarantine them. If they have disease, they get over it, and then you introduce them to the herd. If they're persistently infected in some way, then that may not work. They may harbor that infection throughout the quarantine period and then take it on into the herd. So it sort of depends on the particular disease that you're interested in, how effective quarantine is. You may also quarantine, in the case of BVD, just during the period when you're waiting for test results.
Right. And so, but for a lot of times, especially if you're just looking for PIs.
Right.
But like for transient infection and as we discussed, that can be 17 to 21 days. I'm assuming that's why a lot of quarantines are 30 days long, that most disease processes or viruses are cleared from the body by then?
Right. So that 30 days in some cases would be longer than you need, but just to be sure you don't miss anything, that's a fairly typical. And if they have a carrier state, then no duration is long enough. So we need to do those some other way.
And then lastly, we talked about it on within herd, but I'm assuming that understanding vaccine history of the animals that are coming in and having a processing protocol or a herd health protocol for arrivals is important.
So, and I think that's a great point, because one of the best ways to manage your biosecurity is when you buy from herds who have good herd health programs and good biosecurity themselves, and they'll be much less likely to be infected. If you're interested in Johne's disease, then that's almost the only way to control it. Testing individual animals at entry to the herd for Johne's is almost useless. Buying animals from negative herds is a pretty effective way to keep it out.
Perfect. Communication, get your vet involved. All great advice from Dr. Sanderson. When we come back, we're going to talk about ramping up in case of a foreign animal disease. You're watching DocTalk. We're sure glad you joined us.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, Dr. Dan here. Welcome to DocTalk's Season of Giving with Merck Animal Health. This week, we're going to be giving away the All-Flex syringe gun. Okay, now how do you win this? You go on our website, www.doctalktv.com. Just click Season of Giving, register for our newsletter, and you'll automatically be entered to win this prize. And guess what? If you win the syringe, we'll throw in a cap with it. Thanks for watching, and we'll see you down the road. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Mike Sanderson, and we're at Kansas State University where Dr. Sanderson serves in the Department of Diagnostic Medicine and Pathobiology as the Jones Professor of Epidemiology in the College of Veterinary Medicine at K-State. Great show so far. Thank you.
Thank you.
And let's talk a little bit now about you have done a lot of work with biosecurity and foreign animal disease, specifically foot and mouth disease.
Yeah.
So we talked about some of these little practices we do. Tell me how it would change in the case of a foreign animal disease outbreak.
I tell people this is a part of my work that I do that I hope turns out to be utterly useless, because I hope we never get a foot and mouth disease outbreak.
I'm with you.
But if once that happens, because foot and mouth disease is so infectious, it's so easily transmitted, and because it's such a big deal from a trade standpoint and everything else, the level of biosecurity will have to be elevated dramatically. So the things that you would do here are not everyday practices, and no one's suggesting that producers should do these kind of things. But once FMD's here, then you probably want to be very strict about importing animals. And only from herds that you have reason to believe don't have FMD. Not just you haven't heard, but they have taken some positive steps to decrease the risk that they would be a source for you. So really careful that way as far as imports. And I'd like my sources to be also implementing a really enhanced biosecurity plan.
And when you mean imports?
Yeah, I mean imports from another herd to my herd, not external. So I'd like them to be doing that as well. For within my herd, I want it pretty closed off. I want to be controlling traffic on and off of my premises. Don't let people on that you don't have to. Try to control wildlife contact. That's a pretty big challenge, but I would try to do as much as I could to control wildlife contact.
Because deer
are certainly can get FMD and could transmit it then. So if you're in an area where there isn't any around you, then the deer are probably not a problem, at least not yet. But I would still be very careful. We talk about something called a line of separation, which really is just a line like a moat that you'd put around your farm and control access. Preferably trucks that might come on are going to get washed before they come on, and probably washed before they go off. So we'd like to limit that, and we'd like to set it up so that if we need feed deliveries, we could have the truck stop outside our line of separation. The truck doesn't come across it, so it doesn't contaminate everything, and we auger feed across the fence or something. We would be doing serious things to try and control any introduction.
I've even seen on some of these swine truck washouts that they have drying units for the trailers that take them to like bake them.
Yeah.
To get hot enough to kill bacteria and viruses.
Yeah, they did that for PED.
Yeah.
And because they had to.
Yeah.
Luckily, we haven't had anything as bad as the swine guys do.
No, just a great show. Thanks for spending time with us.
Thank you, Dan.
And remember, always work with your local veterinarian. And if you want to find out what we do, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson with Dr. Mike Sanderson, and we'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.